Emma, thank you very much, and welcome everyone to the November WebEx series as part of our monthly SPSP Medicines WebEx series. And you'll notice today we're focusing particularly on some testing and development work around a Clozapine handy guide for service users. And it's fantastic that we're joined by a number of colleagues working across the Scottish Patient Safety Program, both here within Healthcare Improvement Scotland, as well as individuals working out on boards who have been instrumental in some of the testing and development work. I'd also like to particularly welcome any people for the WebEx for the first time. We particularly want to welcome our public partners and patient representatives and any other people that might have been joining us for the very, very first time. It's great to have you along. And so to help with those people who have not used WebEx before, as Emma has mentioned, all of the lines are automatically muted, but we will be opening the lines towards the end of the WebEx today to allow for some question and answers with the presenters. So we ask that for people who do want to comment or chat, because we do not want to discourage any of that, to ensure that you use the chat box, which is part of the WebEx function. We do ask that when you use the chat box to ensure that you select all participants from the Send To box, which is in the bottom bottom right-hand side of your screen. And by doing that, you'll be able to actually send messages to everybody, and they'll be able to see exactly what you're writing as well. And at the moment, we've asked, and thank you all very much, for people to introduce themselves, to let us know where they work and what it is that they do. So this is absolutely fantastic. We can see that starting up just now. So for those who have not been part of the WebEx series, the SPSP Medicines program is supported by a small but well-formed group. We have Arvind Varaya, our clinical lead, who I can see is on the chat box this afternoon. So hello, Arvind. And in the room with me as well, I have Janet Heritage, our project officer, Kirsty Allen, our administrative officer, and myself, David Maxwell. But we also, as I mentioned before, have a number of other colleagues from our mental health team within SPSP. So it's absolutely welcome to you all, including Sandra, who's sitting with us in the room here in the Guile. So that's absolutely fantastic. So our WebEx series to date is focused on three key areas, and there are three key areas that we've been working on and supporting boards to focus on when it comes to medicines and medicine safety, looking at transitions, omissions, and high-risk medicines. And it's fair to say that we've realized, and with our learning with boards, that these are all very much closely and interlinked in terms of where we need to improve. But today we're specifically focusing on one of these key areas, that being high-risk medicines. And just before we hand over to the speakers for today, the framework that we use to help consider high-risk medicines is really a framework that's been applied to a number of different areas when we consider safety within Healthcare Improvement Scotland. And it's how we better prevent, recognise and respond to harm associated with high-risk medicines. And we know, and I think a number of people on the call would be able to tell us as well, that what medicines are considered high risk very much depend on the type of patients we might be treating in terms of their illnesses and other factors that come along, where they're actually being cared for, and also the staff in terms of their experience with particular medicines. And we've been working across all care settings around this context of high-risk medicines, including acute, primary, dentistry and mental health, and it's today that we're focusing really on some of the work that's happening in mental health. But before we get started, we're really keen to make sure this is an interactive part of the WebEx as well. Although we can't hear you, we're really keen to make sure that you can engage. So in addition to the chat box, we use a number of polling questions throughout the WebEx. So Emma, can I hand over to you to provide, first of all, some instructions on how to use the polling and then to open the first poll question, please?
Certainly. If you'd like to open the polls by clicking on the polling tab in the top right-hand corner. If you'd like to read the question, make your selection, and then press the submit button. So again, the polling tab you'll find in the top right-hand corner. If you click on that, it will open up, make your selection, and then press the submit button. Okay. I can see we've just got the last few going through on that now. There we go, it's got one in progress. I'll just wait for that to go through.
Thank you, Emma. So we'll be using polling questions both at the beginning of the presentation and towards the end to help gauge, I guess, opinions and reflections on the topic that we're talking about today. But can I rest assured that there's no right or wrong answers for any of the work that we're doing in terms of learning and sharing today. But you'll see here that the polling itself gives us a fairly quick idea of the types of folk that we have on the call today, and it's great to see that we've got representation from all of the groups that we've been particularly wanting to get on board today in terms of patients, medical, nursing, and pharmacy. So that's absolutely fantastic. So without further ado, I'd like to introduce Jonathan McLennan, a colleague of mine here at Healthcare Improvement Scotland, who's the Improvement Advisor for the Scottish Patient Safety Programme focusing on mental health. So Jonathan, over to you.
No, thank you very much, David, and thanks everybody for joining the call today. We're hopefully going to take you through some of the origins of the work we'll be doing in Clozapine, maybe also explain what we mean by handy guide as we're going through that. But the first thing I'd like to do is pass back over to Emma for our first sort of live poll again of the afternoon. So I need to move the slide on 1 second. So it relates around side effects of medication, because as we're going to talk about the number of us over the next little while, this is why we are going to be having this call this afternoon. So the poll is, how comfortable are you talking with others about side effects related to medicines?
That's it. So the poll is now open. If you'd like to make your selection and then press the submit button. That's it. So just make your selection and then press the submit button. I can see we're still having the results coming in. There we go. The poll is now closed.
Okay, thanks, Emma. So there's a right broad mix there. From very comfortable, which is kind of reassuring, but I suppose part of life is where people are very comfortable in doing it, that they share their skills and abilities with other people. And interesting there, where we tried not to talk about side effects as well, and that's really one of the reasons that we came up with this initiative in the first place. So what is that initiative? So it's the second poll first. We're talking about Clozapine and we're talking about the side effects of Clozapine for the second poll. In terms of what you think the most common side effect of this medication is, have a go at this poll and we'll see what the answers are there.
Okay, the poll is now open. So again, if you'd like to make your selection and then press the submit button. Okay, it's waiting for the last people to make their selection. There we go, still got some people making their selections. There we go, the poll is now closed.
Okay, so again, a mixed bag of results, and I hope she doesn't mind me saying this, but I'm in the room with Marianne just now, who's an experienced pharmacist, and neither of us were sure there which one to choose, and I'm a nurse of a number of years as well, and I've been working with Clozapine for a long time. So there's no right or wrong answers in this one. However, we'll explain why we asked that question in a little while. I'm going to talk to you for a little second about the premise that if you want to know something, you have to ask the question. And something that we're very proud of as a patient safety programme is the Patient Safety Climate Tool, and I'll get to where I'm going with this in just a wee second. Patient Safety Climate Tool is a service user designed and authored and edited patient safety climate tool that asks questions around these three broad themes about relational care, about how you feel medically in terms of your treatment, and how you feel in the environment. It asks questions like, do you feel safe in the daytime? Do you feel safe at night? It gets into questions that asks about how you feel if you saw somebody being restrained. If you were restrained yourself, did you feel this was done safely, and were you fed back on why it actually happened? And it's delivered by people who are not part of the ward team. It's a facilitated survey. Now in Glasgow, they've done in excess of 400 of these surveys. And part of that was there was a load of information came back from an awful lot of people about medication, and that side effects of medication in particular hadn't been discussed with the patients. So what we took from that was that a number of areas, including Glasgow, have had to go back and action plan and say, how do we not necessarily upskill our staff, but how it goes back to that first poll. How comfortable are our teams? How comfortable are our practitioners to talk about the side effects of medications? Not just the therapeutic effects, but also the side effects of medications. Actually, how comfortable are carers? How comfortable are patients asking about these sort of questions? So that's why the word culture is used in amongst all of that. And that information, apologies for the slide, but that information is currency. We have to use this sort of kind of direct feedback to make changes in the care that we're actually delivering. And the one that came to the top for us, and this has probably been, just checking with Marianne here, about 2 years worth of work now that we've been looking at Clozapine in particular, because we recognise it as a high-risk medication. So where do we start? Well, this is a quality improvement programme, and all we know is driver diagrams and Plan, Do, Study, Act. I'm joking, but the reality is how do we improve the dialogue between the service user and the service, increasing the patient and care team and carer awareness of the high-risk aspects of Clozapine? And that's why we asked that question about what the most common side effect is, because what was fed back from Glasgow was it wasn't the weight gain, it wasn't the hypersalivation, and it wasn't the sedation elements. It was actually the issues round about constipation. It was the issues about flu-like symptoms and abrupt smoking cessation that can have real implications for people when they've stopped smoking, obviously. And how do we do that? When we get an idea, the one thing within quality improvement, and certainly within the patient safety programme that both myself and David work in, is that we have to go out and we have to get an understanding of what people are doing. We then have to take that and then say, well, what can we actually do about this? How can we support change in this? So we pool the best people that we know together, which includes the likes of Marianne and Jean and Forth Valley and a number of others. And the one person that's not on the call today that we have to thank is a chap called Andrew Walker, who's one of the lead pharmacists, or is the principal pharmacist, better give him his proper title, in Greater Glasgow and Clyde. And we pulled together this driver diagram that says, so it's a handy guide. It's a little card that has a number of different side effects and choices and things on it. It's a small piece of card, basically. You'll see an example of that shortly. About asking people, what do you think about this? And it's for service users, it's for carers, it's for frontline teams, it's for primary care, it's whatever it seems to be used best. And it looks a little like this. Now, the one thing about testing and test or change, we probably went through 20 or 30 versions to get it to this, and this is still in test. So these are the characteristics and the key areas that we're looking about. Asking questions like, do you know why you need regular blood tests? Now that might seem for somebody that's been on Clozapine fairly recently as a bit of a no-brainer because the blood tests are weekly, they are frequent and they do not stop there. It's pretty intense. But what about somebody who has been on Clozapine for an awful long time where the blood tests are less frequent? And actually, is it a bit of an aid memoir to go back and remind people how important that they are because of all the potential effects if you don't know what's happening within your blood results? Constipation, I'm not going to go too much into the whole kind of clinical characteristics, but there's a great deal of evidence now, and even more comes in week by week from various parts of the world, even England, round about various things that can happen. We know the very positive effects that happen with Clozapine aligned with all the other care and compassion and positive treatments that go with it too. It's not just about medication, I hasten to add. But when there's something as effective as this, we have to make sure that it's managed as safely as possible because we do view it as a high-risk medication. So that's all I really want to say on that at the moment. That's the kind of introduction to it just now, and I'll have a look in the chat box just in a wee second once I finish speaking. But I'm going to hand over to Marianne van de Leo, who I have actually worked with on and off now for the last 20 years. I know she's cringing at me saying that as well. So I'll just hand over to Marianne, who'll introduce herself.
Hi, thanks very much for that, Jonathan. Jonathan says I'm Marianne. I'm the lead clinical pharmacist here in NHS Lothian, and I just want to take a few minutes just to chat through the experience that we had in testing this Clozapine handy guide within Lothian. So as Jonathan said, I'd been part of the kind of national group that had been looking at developing this on the back of some issues that had come to the fore around Clozapine, and what we knew was the need for certainly service users to be given more information about their medication. So we piloted, or decided to pilot the guide, as you can see here on the slide. We decided to pilot that with a couple of our teams in Lothian. But so the first thing after we'd had the idea kind of nationally sitting around the table and we got them printed was, well, where were we going to start? So thinking about it, it was, well, who are the stakeholders in terms of, for us in Lothian, where are they? And actually the practicalities of, so this is a guide where we're actually going to be, you know, handing it out and giving it out. So I was thinking about, well, where are we actually going to do that? Also, what time frame are we going to do that over? And then how are we going to get the information back? So while it seems like a really easy and simple thing to do, just to hand out a bit of paper to somebody with some information on it, you've actually got to, actually have to plan it. So our plan was that we would test it in 2 of our community mental health teams. Within our community mental health teams, they run clinics on a weekly basis for patients who are prescribed clozapine, where the patients come in to get their full blood count, or the blood count taken on a regular basis. So from that point of view, it's quite easy because you're able to engage with the people that you want to speak with. So we plan to hand out the guide over a 4-week sort of clinic cycle because, as John's been saying, patients who've been on clozapine for quite a long time, they don't have their blood tests done quite as frequently, but they do have them a minimum of every 4 weeks. So we had planned to test this out between June and July, and then follow up over the next 4-week period with a facilitated questionnaire. So where the community nurses who were facilitating this in terms of handing the guide out to patients, we were then asking them to hand out the questionnaire the next time the patient came into the clinic and support them in answering that. But in terms of keeping a track on who we had given the questionnaire out to, we used a checklist from the patient lists that we have in our centrally in the pharmacy service here in Lothian. So we prepared some checklists for the clinics to use just to effectively tick box really to see who'd got the card and who had given us feedback. So that was the plan. The reality, however, was slightly different. So we did find, unfortunately, the guides weren't routinely given out. There had been some miscommunication with the clinic, the same member of staff. Also, you know, although we knew which patients we'd handed the guide out to, we weren't getting questionnaires back from them. And then what we discovered then was actually the time frame was too long. So we were giving the guides out over a month, and then the following month trying to get all the feedback. And some of the feedback we were getting from patients was actually they either didn't really remember getting the card, or they couldn't really remember what, you know, they hadn't looked at it since, so couldn't easily recall what the advice had been that was on it. So we started again. So we did it again in September. We did another cycle through September and October. So we sent 200 cards out to both of the teams, although the patient numbers in both those teams is 110 in total, and we received 13 written responses in terms of the questionnaire feedback. So that's 12%, roughly, which I suppose, well, I'll come on to the learning in a bit. So it was slightly disappointing we didn't get as much, or in terms of quantity of feedback, as we'd hoped. But the results of these 13, just in terms of the questionnaire and what we were asking, was that everyone who returned felt that the message on the card was clear. So interestingly, 5 of the questionnaires came back saying that some of the information on the cards was new to them. And when I broke that down and looked at the specifics, interestingly, it's those side effects that Jonathan was mentioning earlier, that the new information to some of our patients was around the issues with stopping smoking when you take clozapine, the constipation, and also the cold and flu-like symptoms. In terms of what impact the cards made, you can see there that overall they didn't necessarily encourage people to ask more questions. We didn't have anyone really say that it changed anything that they were particularly doing in terms of their lifestyle, except for one patient who had come back to saying yes, they were actively trying to do something more about controlling weight gain. A few had said that they would have liked to have received more information, mainly about more information about side effects or other side effects, and one specifically asking for information to be given to carer. But encouragingly, in terms of changes to the guide, the majority felt that the guide was, was fine in terms of the information provided. There was just a couple of people that specifically said that more information would have been helpful. So in terms of the results then, just this is a quote from one of our CPNs who's been helping us with it. Just in terms of the fact that there was kind of a poor number in terms of the written replies from the questionnaire. But certainly in terms of verbal feedback, patients have said that the handout was helpful. Many didn't realise that constipation was a side effect. And this appeared to be the main surprise for many of the patients that were asked. So this is I don't have the numbers in terms of how many patients gave verbal feedback. But we do know that most people actually took the handy guide, but they weren't filling in the questionnaire for many reasons, and potentially it was to do with perhaps the wording of the questionnaire, or how long it took to fill in. I can't recall. I must admit I can't recall how long it was. It was 1 page. It was either 1 or 2-sided. I'd need to go back and check. Sorry, I can't recall. But where we were in terms of lessons learned, I suppose I was a bit disappointed that it hadn't really taken off the first time we tried to do it with our colleagues in the community mental health teams. So perhaps there's a little bit to do with engagement of the stakeholders. Myself and my colleague Heather Kelly had kind of gone to the gone out to the teams to ask them, could they pilot this for us? Could they give it a try? So from that point of view, we were coming as, although we're colleagues in the team, just coming out to say that, can you do this for us? So from that point of view, we were kind of imposing something on colleagues rather than them being engaged in it being their own project. As I've said before, actually, we think that actually the time frame for follow-up was too long. So we should really have been considering handing out the guide and then getting feedback from patients that same week when they came back to collect their medication. And also, I suppose what we also know from written questionnaires anyway, they're not ideal for everyone. So perhaps we should have been considering some kind of mixed format response and having more of a, where we were getting patients who were actually giving verbal feedback, having some more formalised way of collecting that. And sorry, thank you to Heather in the chat who's just come back to say that there was 8 questions in total on the questionnaire, and patients are either completing it themselves or doing it through facilitated completion with staff. So the next step for us in Lothian, so this is my last slide, just to say, we do plan to set a test up in the 2 other community mental health teams within Edinburgh, obviously using the feedback provided. Want to explore some other local resources and networks to try and increase awareness of clozapine side effects, and also to then look at moving this into our inpatient setting within our wards and hospitals in Lothian. So thank you very much for listening, and I think we're taking questions at the end. So
thanks, Marianne and Jonathan. Thank you very much.
Back to David. Thank you.
Thanks. And it's my absolute pleasure to now introduce Kevin. So what I think we didn't make very clear at the front of the WebEx today is the testing's been happening across a number of boards. So we're going to have a whistle-stop tour around some of the boards across Scotland this afternoon through the WebEx. So it's my pleasure to introduce Kevin from Lanarkshire. And Kevin, can I just confirm with you that you're able to see the WebEx this afternoon?
I think Kevin's actually joined on a participant line, so he's muted. But Kevin, if you can do *0, I can find your line and open it up for you.
Thank you, Emma.
I can see he's in on the WebEx, so if you just do *0 on your handset, and then I'll be able to see which your line is, and I'll be able, there we go.
So as I say, we've got a number of people from of other boards, and so we're going to be hearing from Kevin, who's coming from East Kilbride in Lanarkshire, followed by some colleagues in Fife, and finishing off with Forth Valley. So we'll get a fairly rounded view in terms of what's been happening. So Kevin, can I just check, is that you in on the call, please?
It is, yes, I think so.
Hi. Kevin, we can hear you loud and clear. That's fantastic. So can I just check, are you happy for me to progress the slides as we go through? In terms
that's fine.
Okay. So all I'll do is listen to your cues, and if I get it wrong, you can give me a yell, if that's okay. So please, the floor is yours.
Okay, so our CMHT, we have a Clozapine clinic. There's 39 patients on Clozapine in East Kilbride CMHT just now. All those patients are well established on the medication, so there wasn't any that was being titrated at the time of doing the trial. And one patient had actually stopped taking his medication before we got to the end of the trial period. So what we did is, because we have a Clozapine clinic where we take the bloods and the patients are then posted their medication direct from pharmacy. So when they came for the bloods, we introduced the handy guide, and as agreed at the previous WebExes, we did the first 4 questions about how the patients perceived the layout of the card and the information that was on it. And then, as we had planned with the clinics, we had the same people doing the clinic for the whole trial period, just to make sure that there was a continuity in the trial. So, when we handed the cards out, all of the patients stated that it was well designed and easy to read, and they thought it was kind of quite clear, the message it was putting across. Okay, and again on the first introduction, the flu-like symptoms and smoking being an impact on the Clozapine was right across the board with all of the guys about the importance that they were unaware that feeling poorly or stopping smoking or starting smoking was so significant. I think that's a duplicate slide. So the main questions that were asked, and it was initially really on the first session, as was highlighted from Lothian, that when you introduced the card, there seemed to be, we thought the 4-week period was too long. So most of the information that the card was kind of spoken about on the initial discussion I had in the first time. And I think the biggest one was, why was the flu-like symptom so significant? And that's where we had the discussion about the impact on white blood cells and that they become at risk for infection from others. One of the main kind of findings, I think, is that the patients seem to be a wee bit less dismissive of the side effects. When we do a routine clinic, although we don't do a full gas, we ask what side effects they are experiencing, and it seems to be that even if they seem as insignificant, that they were mentioning things, even if it wasn't kind of a typical side effect of the medication. So our patient group didn't ask for any further literature or anything else based on the information on the card. They seemed to be quite happy with the verbal discussion, and they didn't actively seek any kind of direction to other, be it websites or written information. But probably the fact that the patients didn't seem any need to offer any feedback on any change of the design or content. We're not entirely sure whether they didn't understand the importance of what we were setting out to achieve, or perhaps didn't feel kind of confident in offering any kind of feedback. Perhaps that was something we should ask in retrospect. I suppose the one thing that was connected, it was quite encouraging that all of the patients who started the trial, with the exception of one person who stopped taking the medication, had offered their opinion and participated fully. Although we had found 3 of the little cards who had actually been discarded in the locality. So be that kind of the fact that they lost it or that they didn't find it important, we were unable to kind of ascertain on that. Unfortunately, the PowerPoint thing was kind of a surprise to me, so I didn't have time to do a lengthy presentation, but I hope it covers what we achieve.
And Kevin, thank you very much. And as I say, it's great to hear the different perspectives in terms of the Lothian testing and then moving to Lanarkshire. So with no further ado, we're going to pop across to another part of the country. And in terms of introducing Katie, can I just check, Katie, have you been able to join the speakers panel, please?
I haven't seen her signal yet. Katie, if you can just do *0 for me, then I'll be able to locate your line.
So Katie's joining us from NHS Fife, and you'll see from those who've been monitoring the chat box, she's a mental health quality improvement facilitator for the board, and it's great to have her here. I know she's one of a team of folk that have been looking at testing the Clozapine handy guide in Fife. So can I check, Katie, have you been able to join us?
I haven't seen her signal yet. Katie, can you do *0 for me, please?
And in the interest of managing to wait for Katie, we might go across to the other side of the country a little bit to Forth Valley, because I know, Jean, you've joined us as well, and you're very keen to share the experience of testing the resource in Forth Valley. So, Jean, can I hand it over to you until we find Katie, please? Jean, can I just check that you're still with us?
Hello?
Hi, Jean. That's fantastic. You've made my day so much better.
Sorry about that. I just had you on mute there, and I was just, apologies everybody, I'm in an open office. I was just asking my colleagues whenever I start speaking if they can keep a little bit quieter.
Thanks, Jean. So we'd really love to hear your reflections in terms of the process of testing, any key learnings that you've got out of the testing the handy guide.
Sure. Okay, thanks. So reporting in from Forth Valley. So we have a little project that's rolling out Clozapine dispensing to community pharmacies, and currently we have 19 pharmacies across Forth Valley who are directly registered with ZTAS and dispensing Clozapine for patients in the community. So we thought we would do a little bit of a kind of dual testing to see if we get some feedback from both the community pharmacists, because we felt the handy guides would be good learning for them and helping them to help the patients to understand Clozapine a little bit better, and also ask the patients themselves. So we sent out a letter and a pack explaining the project and the guides and evaluation sheet, and that was to all the pharmacies engaged in July and August. Then we emailed a couple of months later in October to prompt for feedback. And again, like the previous speakers, Marianne and Kevin, I think the time lag was probably a factor in that we had very poor response. So I have a few results from that particular part of our project, and we've tried to chase up. So we've only got 4 responses, I'm afraid, 2 from patients and 2 from staff. But they do kind of reflect the discussions earlier in that generally the patients, so that's two patients in community and 2 of the community pharmacy staff, felt that the handy guide was easy to read, the design was good. Did they learn anything new? There was one of the patients learned about constipation as a side effect. In particular, I thought it was quite interesting, and did the handy guide encourage you to ask more information? So the patient said yes, and the community pharmacist also thought that the patient should ask more, and it would encourage them to chat more with the patients about issues and raise the issues of things like smoking and constipation. So I think that was helpful. Regarding changing behaviours, one said that they would, you know, the pharmacist again said they would engage in conversation with the patients about potential side effects. The changes to the card, there was a couple of suggestions of space for contact details from both the patient and the pharmacists. So that's a kind of summary of that part. We also surveyed or put the questionnaire out to patients within our community mental health team. We got 8 responses from there in the Falkirk area. And again, similar themes to previous presenters. Everybody was felt that the design and clarity of the message was very good with the handy guide. Again, there was sort of 50-50 learned new or didn't learn new. Those that learned something new was about smoking issues and constipation. Again, it was 50-50 split on whether the handy guide helped them to ask more questions, so that was interesting. 4 said yes, 4 said no. And what have they done as a result? Well, there was 2 of the patients said that they were looking at their diet and fitness, and 1 said they were still smoking but not as much, and so that was helpful too. The other thing was round about changes to the card, suggested changes. 1 patient suggested adding tiredness, depending on dose, to the list of side effects, which I thought was quite interesting. And again, it was round about helpful phone numbers and contact details for suggestions of changes to the card. So I think that summarises the feedback from Forth Valley.
Jean, thank you very much, and please commend your work colleagues for being very quiet while you presented. It was really, really good, and I guess we're hearing some fairly consistent common themes throughout, but also some variation in terms of some of the feedback, and it's really, really good to have all these perspectives. So I have in good faith confirmation now that Katie from Fife is with us. So Katie, can I ask just to give us a hello before we move to your slide?
Hello, yes, I am here.
Hi, Katie. Thank you so much, and thank you for joining to really round off the feedback in terms of the 4 boards testing the Clozapine Handy Guide. So over to you in terms of the experience in Fife.
Okay, hello. Sorry, I'm fairly new to WebEx, so that was a bit of a guddle. But what we did was we tested our Clozapine Handy Guide in a community setting. Issues with the Clozapine, and we also did it in an inpatient rehab setting as well. Over the 2, we got 17 responses. What we did was we broke down the questionnaire into 2 parts. So we had questions 1 to 4 when it was first given to the patient. A member of staff would sit down with them and speak through the questions in the questionnaire and get feedback from the first 4 questions. And then about 2 to 3 weeks later, depending on people's appointment times, the same thing was happening again in the same format, where they were able to sit down and speak to a member of staff to answer the rest of the questions. Generally, we actually had really good responses, given that we only had 17 people that it was given to. They were all really positive about the design of it, very positive about the colour, thought it was really good for kind of lifting mood, things like that. Very clear message, very clear and easy to understand. From the point of view of learning anything new, that was exactly 50-50, but they were commenting on the fact that they didn't realise about flu-like symptoms and constipation and smoking. So they seemed to know about weight gain, but not the other parts. It did encourage 29% of them to ask for more information. The rest of them didn't want anything else. There wasn't a great change as a result of the handy guide. Most people said that they hadn't changed anything, but a couple commented that it gave them greater awareness of side effects and knowing to speak to a member of staff if their smoking habits change. Half of people did ask for more information, either for themselves or for their family. And the only other thing that they would like added on to the handy guide was a space for an emergency contact number. But generally, yeah, really good kind of trial, really good feedback from everybody, and there was only one person who didn't participate in giving any feedback.
Katie, thank you, and thank you for persisting with the new technology to share some really important aspects of the work. And I think there may be some other boards that have shared their works just now that may be quite envious of your response rate, although you seem to think that there was one person that didn't provide a response. But it's just one, so that's something I think we'd be really keen to learn a little bit more about. But less from me and more to everybody else on the call today. So Emma, can I ask you to open the lines, please, for some questions and discussions? And I think that there have been a couple of questions to the chat box, and I might actually start with the question that's just appeared in the chat box from Fran. So Fran, are you comfortable to ask the question yourself, or I can read it through from the chat box? But welcome to the WebEx, Fran.
Hi, David. Thank you. No, I'm happy to kind of ask it. I don't know if it's a silly question or not, though. That's the only thing. I mean, I just wondered if it was the reason why people take Clozapine. I don't know much about it, obviously. But obviously, I understand it's an antipsychotic, but could that be part of the reason as to why there's some reluctance in people answering questions or taking part?
So, Fran, it's Marianne in Lothian. I was going to say it's not a silly question at all. I would say potentially. I mean, I think you're right. I think that could be. Whether it's just people, you know, reluctant to talk about the fact that they're on medication at all and why they're on it, or perhaps in some ways maybe not wanting to admit that they actually know they don't really know. They just take it and, you know, what to. Yeah. I kind of, in some ways, just want to forget about it otherwise. Whether that would be something that, in terms of feedback, we could build in, you know, if there's any way of doing that, you know, just to try and gauge why people are reluctant to answer questions.
Right. Sorry, carry on. Beg your pardon.
No, I'm just going to say I'm glad it wasn't a completely silly question then.
No, it wasn't at all. And it sort of highlights some of the cultural aspects of prescribing in mental health as well, which is, if we're being honest, there's a degree of command and control within that. And actually, it's a conversation piece. It's part of somebody's treatment. So, no, not a silly question at all.
Okay.
Thanks, Fran. Are there any other people that, I know there's a couple of questions in the chat box which we can definitely get to, but I would want to make sure people on the call, what questions do you have for our presenters this afternoon? Okay, while you're still thinking of the questions to ask, because I know there will be a few, just reading out, Arvind, I know you've asked in particular if there's any people that were actually wanting to take treatment to avoid constipation, maybe perhaps once they'd learnt about this new side effect for them.
Yeah, thank you, David. Yes, I think what we've heard is that some of the users mentioned that they would speak to healthcare staff about any change in their smoking habit, and that seems to have been a direct impact of the handy guide. I just wondered whether there were any others that were cited by people. Did they ask for treatment for constipation, for example? Or did anybody express any worry about taking this tablet because they already suffer with constipation?
Hi, Arvind. Sorry, it's Marianne again. Not that I'm aware of from the Lothian point of view, although we had some patients say that, you know, they haven't been aware of the constipation. We didn't have anything in the questionnaire or the feedback from CPN colleagues, community nursing colleagues, saying that patients had specifically then asked for treatment or said that, no, I do suffer from that, so what can I do about it? I think for me, just, you know, from a professional point of view as a pharmacist, I mean, I'm fairly sure I talk about this all the time, you know, around, you know, constipation with Clozapine, but I'm obviously not talking to the right people and I'm not getting the message across because, you know, our patient group who actually take the drug aren't all aware of it, and we need to do something else as well, you know, as well as the handy guide to improve that.
Thanks, Marianne. David, if there aren't any other questions just now, can I ask a question?
Of course you can.
So, I mean, Fran, your question was really valid, but I'm thinking of it slightly differently. I'm wondering why people were not asked to tell others about whether the document was useful or not on the same day. Because I think there's always a problem that people pick up a document or a card, they read it, perhaps they let it influence what they do that day or the next few days, or try and remember it, and maybe they even may bin it. They may still use it. So would it have been possible to get feedback on the same day after they picked it up? And would that have been different than the one that was got 4 weeks later?
Sorry, Arvin's Marianne again. I mean, yeah, that was certainly one of the learning points that we kind of took back from it. That you know, we were having patients saying, oh, they might have remembered getting it, but didn't really recall what it said. And I think we're thinking if we roll out and test it in another couple of our community teams, and certainly in our inpatient setting, that we would do it differently. We would definitely gather feedback in a much quicker time frame. I think, the initial premise of actually trying the guides out was actually to give people the, if they couldn't stay particularly at the clinic after they had the blood taken, and they wanted to get away, we were actually giving them the time to take this information away and read it and go back to it and, digest it. But I think experience shows that didn't necessarily work in terms of getting enough feedback.
Thank you, Marianne.
Okay.
So I think, I'll wrap the questions up to a close. Before we do, though, just to thank the 4 boards that have shared their work this afternoon, and for Jonathan in terms of leading the work nationally. Can I finish with a question to you, Jonathan? There's been some fairly consistent feedback around potential changes or additions to the Clozapine Handy Guide. What plans do you have in terms of next steps nationally to support the continued testing?
Yeah, absolutely. So, I mean, we were going to use, I was certainly using today as a bit of a deadline for that, and it's been great to have everybody listening to our conversation actually about how we've got all that information together. Hopefully next month we're going to come together either virtually or together to kind of reevaluate and take stock. Because as with everything, we have to apply some resource to this to develop the card even further. But certainly from what I'm hearing, it's not too far off where we want it to be. One of the suggestions that had been offered was that we put in another space where somebody can actually write down some information about the medication and where it's collected and that sort of thing. So the plan will be is to kind of finish off this round of testing. We're probably looking tail end of December, early next year, and then come back together. And if the 4 boards and the 4 groups that have been testing are happy, then we would offer this out to the remainder of the areas as well. What's been really good as well is that we've had a good cross-section across from inpatient rehab through to community pharmacy, but we need to make sure that we've got as many places covered as possible. So that's a bit of a long-winded answer to soon, and we aim to have that sort of up and running early next year.
That's fantastic, and thank you again, Jonathan. And I think one of the things I'd like to do before we draw to a close, Fran, absolutely thank you for your comment around the fact that as a patient or a service user, you'd think you want to give feedback on the day, a more immediate response. And I think it's feedback like that that would help shape how we would do things in the future, particularly around how we best engage and receive feedback from people using the service. And Sue, thank you as well. I can see too you've asked a very poignant question around awareness of side effects in the first place. To actually ask the question of patients actually realise they might be suffering a side effect rather than thinking they might be feeling just under the weather at that time. And again, that's the power of information, absolutely. So thank you for asking that question. So before we close the WebEx, for those people who have not been part of the WebExes before, this is not the one and only one that we do. We do run these WebExes every month. So just to remind people of the plan between now and February is the fact that we're giving everybody a Christmas break next month, so there will be no WebEx for December. But can we ask you to mark in your diaries the 18th of January, where we've invited 2 SPSP fellows from Norway who are going to be coming and sharing some of the work they've been leading on related to medicines, one of them being a virtual hospital, and it's managing patients at home who are on what they've identified as high-risk medicines. And they're also going to share a fairly unique model around reducing medicines harm at transitions into the acute setting. In a particular note, the fact that they don't have any clinical pharmacy services, so their service and design is very different to perhaps what we're used to. And in February, we're going to be hearing from another SPSP fellow who's been working on a particular area of medicines reconciliation at discharge, so from leaving hospital going back out to the community. And we're also privileged enough to be hearing from colleagues in Canada who've been leading on a national medicines reconciliation program in Canada for a number of years, and they're going to be sharing their experience. So again, please do mark those dates in your diaries. It would be great to have you along. Before we do go, just as a reminder, this WebEx has been recorded. It will be published in terms of the slides and the recording on our website, and you're most welcome to share that link with everybody once that link is available, and we'll tweet that in case you're not able to access the website directly. So we look forward to seeing you and hearing with you again, I hate to say this, next year in January on Thursday the 18th. So thank you all very much for your time.